All right, Emily, thanks so much for doing this. My first question that I have for you is just tell the audience a little bit about yourself and how you got started in the physical therapy realm.
Yeah, thank you so much for having me. It's an honor. My name is Emily Ramon, and I am a neurologic physical therapist. I'm also a dog mom, my other job. Um, I work with people in physical therapy with a wide range of neurologic diagnoses, and I have the pleasure of working with people from preteen to people living in their 90s, because my work focuses on helping people understand how their nervous system functions and how they can regain more control or movement and confidence into their daily lives. And then I also do a lot of work supporting people in adapting, accessing, or thriving in different ways that work for them. I got started in this field specifically when I was a freshman in college. I did an observation experience in a living facility for people with dementia. And I was really captivated by the experience of helping people connect to who they truly are, amidst, a system of like nervous system crises or chaos. And I just felt like there was so much meaning in working with people and their families in a way that was really focused on maximizing engagement in life and connection to one's bigger purpose. So that's a little bit about how I got to where I am now.
Hmm. And what are you doing now as a physical therapist?
Yeah, so I am one of our clinic directors at Reactive Therapy and Wellness in the Los Angeles area. So we are an outpatient rehab team of physical therapy, occupational therapy, psychology and neuropsychology, yoga therapy, and a whole bunch of different wellness offerings and wellness professionals. Part of my job is kind of like overseeing the clinic from an administrative responsibility. And then I also work one-on-one with individuals in both a wellness capacity, where I do some health coaching and teach some adaptive fitness classes. And then I also work one-on-one in physical therapy with people. And our model is really cool because because we have everybody under one roof, we do intensives in addition to what people may think of as more like standard therapy care, where you're seeing maybe people a couple times a week. We'll do outpatient intensives where people may be getting, 3 to 4 hours of therapy a day from different team members. So it's a really unique model that we're thrilled to be able to provide.
Hmm. And so my next question is what sorts of how do you make sure that people with sort of mobility problems and others, have that sort of independence that they need? Do you guys focus on weight shifting? Do you focus on stretches, or what's sort of the bread and butter, if you will?
Yeah, our approach at Reactive is a little bit of everything. We actually developed like an internal language we share with other people. We call it our pie chart approach, because who doesn't love pie? But um, we take a really holistic approach in working with people, and that we focus on assessing and intervening in areas of motor control. So that's, how well is my brain and my body connecting in terms of responding to motor commands. We work on the sensory system. How well are my brain and my body connecting sensory wise, to be able to help me plan motor movement or engage optimally in an environment. We look a lot at the autonomic nervous system, so that sense of being, regulated, feeling safe in one's body, finding that homeostasis. We look at the psychosocial piece of the pie, and how fear and different elements of mental health may impact movement. We look at the physical body, where we have, bones and joints and skin, ligaments, and tissues, and how that may influence movement. And lastly, we look at lifestyle. And how routine can help to strengthen connections and help to foster a more healthy baseline of a nervous system in which to grow from. So we have this kind of pie approach where when we first meet someone, we're determining what are the biggest areas of the pie for that person, and then we kind of focus our intervention there or pair them up with the right team member. So I think a lot of the areas of the pie that I spend the most time in are the motor control piece, the physical body piece, and the sensory piece as
Mhm.
well.
So that's like folks with cerebral palsy or ataxia, those kinds of populations.
Yeah, so we see anybody who is having any type of change or disorder to their nervous system. So we'll work with people, like you mentioned, ataxia and cerebral palsy, people with Parkinson's disease, post-stroke or brain injury. We work with a lot of people with functional neurologic disorder, as well as like dysautonomia, hypermobility syndromes. The list would be all inclusive. We pretty much, um, we want to work with anybody who is on their journey to understanding their nervous system, and we want to partner with them so they can make informed, choices about their health and their care, and really help find what supports their mobility and their autonomy in life.
Hmm. How important is it to really place what the individual's needs in their plan of care?
The most important. Um, and we do that I think it's so crucial to do that in a lot of different ways. We have a unique opportunity, I think, in the rehab world to get to see people on a frequent basis and really get to know who they are, personally, and tie that meaning into the intervention selection that we're doing. It needs to make sense. It needs to matter for the individual and what their goals are. So I think, we have a lot of people from the rehab profession and wellness profession here on our team, but the person who drives what we do and the areas we focus on is the individual coming into us to um, start their journey. So I think the driver of everything, the most important piece of any rehab plan is the person walking through those doors or using any type of mobility to get in
Hmm.
through the.
What sorts of things have you learned as a physical therapist? Like how many years have you been at rehab PT?
Yeah, well, I've been a physical therapist for 9 years, and I've been with Reactive for almost three. I have been a little all over the place in my PT career. I graduated and I did a postdoc residency program to specialize in neurologic physical therapy. And then I went and I worked as clinical faculty in a neuro residency program, and now I've found myself here. So I've gotten the opportunity to work on different aspects of our profession throughout my career, but it's been a busy 9 years.
What have you learned specifically, working at rehab active, like seeing the patients with different conditions, what have you learned in terms of like seeing their progress and kind of like taking those steps towards that independence?
Yeah, so much. I feel like I'm always learning about the brain and the nervous system in general. But what has been so great in being part of this team here is learning different ways that we can create space for, choice and dignity and access as a healthcare in the healthcare system. I have learned over the course of 9 years about how crucial and important it is to recognize lived experience as expertise. It's not all about what you read in the book. People know themselves better and best. And I think the other thing that's just so important is to, that I've learned across the course of my career is that it's not so much about teaching things to people, but rather partnering with people and empowering people to understand their own brain and body and nervous system, and find strategies that work for them. And I'm almost like just a tool, kind of like an option or a toolbox or an encyclopedia of things, but I'm not to teach. I'm to partner.
Mm, I see. And what sorts of things do you still hope to learn as a physical therapist? Is there something that you're really curious about that you're like, gee, I wonder what this is about?
Yeah. So something I've been really curious to learn more about is how hormonal and metabolic factors impact the progression and management of complex chronic neurologic conditions. I think there's a lot that we don't understand, and especially given that the research in our field is very skewed towards certain populations, but I think especially when it comes to how hormonal influences show up across the gender spectrum. I want to be able to understand how that shapes care and how that shapes chronic neurologic conditions a lot better, so that I can show up with, scientific knowledge and cultural humility, and provide better care.
Mm-hmm. And like lastly, what tips or strategies, advice would you give to future physical therapists that want to enter the physical therapy profession? Because I don't know how really the journey to becoming a physical therapist was, because I have a friend, who's in, I think, North Carolina, and she right now she's going into um physical therapy school or whatnot. But what's your experience been like, and how does that translate to, what tips, advice would you give to folks?
Yeah, yeah, it's a great question, and good luck to your friend too. I think everybody connects to the career a little bit different through their own, lived experiences, family experiences. But once you're there, I think one thing that I would hope to leave with budding professionals is that it's so important, especially early on in your career, to like shift away from this mentality of fixing people. I think this can be deeply ingrained into budding healthcare professionals, like if they're working with someone with a chronic condition, or somebody's coming in, um, that there's this like healthcare fix mentality, and people are not problems to be solved. They're whole complex human beings with strengths and goals, and it's so important to, I think, to see that, to be able to immediately go into um, types of treatment and types of conversations that are really going to be more empowering for the person that you're working with. And shifting the focus from changing people to changing the care that we provide, and even, the systems that we work in. So instead of asking, how can I fix this or what can I do? Maybe starting to ask yourself or your colleagues in the future, your classmates, how can we support people in living fully and authentically on their own terms?
Mm-hmm. All righty.